We're in the midst of an opioid crisis, and Maine has been very heavily affected.
Addiction medicine is very complex. Along with substance use disorder and addictions disorders, there's many other health conditions that come along with that.
We are a big tertiary care center. Patients come from all over Maine to Maine Medical Center to be treated.
Being in this fellowship, I've been able to work with many different experts in their field and have really learned many new things and many ways of treating addiction.
VA has been a great collaborative partner with us, and we're very happy to be able to offer two very different settings with two different patient populations so that fellows can get a broad introduction to substance use disorder.
There's outpatient experiences in methadone clinics and other rehabilitation programs, both residential and outpatient rehab programs. So there's so much variety to see.
Nonprofit organizations, the needle exchanges, etc. And so being able to do that in a city like Portland is really fantastic.
They learn how to do both individual and group therapy. They work with our adolescent pediatricians to help adolescents who are at risk for substance use disorder or already have substance use disorder.
There was a lot of interdisciplinary care involved. I get to work with psychiatry, infectious disease, primary care, addiction medicine, and there's a good blend of inpatient and outpatient care.
Part of my work is also doing research and working with the fellows on any subject that they're excited about, really, and seeing that project from beginning to end, I think, is probably the most exciting part for me.
From adolescents through elderly, male and female, all substance use disorders, and so it's just a very wide breadth of patients they're exposed to.
One of the things I didn't expect was to really learn how to do journal club and work with other disciplines. We have our didactic sessions are interdisciplinary, so we have pharmacy students there, internal medicine, family medicine residents there as well. So there's unique opportunities.
So when our fellows are engaged in their clinical experiences, they will be part of teams that have residents and medical students, and they are, as the fellows, responsible for much of the teaching that happens for those learners. So it's a great opportunity to learn how to teach on the fly, to give feedback.
I'm just amazed at how collegial it feels. They really speak to you at a level where you feel very comfortable.
We have 6 core faculty who are involved with mentoring, doing a lot of the didactic teaching and a lot of the clinical teaching, both in the hospital and outside.
The faculty was extremely encouraging and accepting. They were patient. We had a good time. It made for really good learning opportunities.
Having a varied faculty can be really helpful for the fellows to develop their own style and take what they like from each faculty member to really figure out what's going to work for them.
This fellowship has enabled me to have a great work-life balance.
Life in Portland is awesome. I mean, you can go to the beach any day, go for a hike any day. All of us really appreciate that we need that work-life balance, and I think it's something we all try to practice what we preach, really.
Much more confident in talking to people about addiction and reaching out and trying to help people that may or may not have an addiction problem. It's become a passion that I think I will continue for the next several years.
There are plenty of opportunities for this and plenty of support to pursue any academic interests that somebody would have here.
So did you say you're happy with your choice?
I'm very happy with my choice, yeah.